Hi, I'm Heather McMullen. I'm the Director of Bariatric Surgery at Syosset Hospital, and I'd like to welcome you to our information session. I'd like to give you a brief outline of bariatric surgery, the indications for bariatric surgery, who's a candidate, and the different surgical options. So what are the causes of obesity? They're multifactorial, including behavioral, environmental, as well as genetic. And for different people, one or more of these may play more of a role. It's not just a positive energy balance. It's not quite as simple as more in than more expended. We eat more than we used to. Our portion sizes are larger. Most people have a much more sedentary lifestyle than we did 15, 20, 50 years ago. Endocrine conditions, thyroid disease, polycystic ovarian syndrome, and insulin resistance can play a role in poor weight loss. Gut dysbiosis. The variety of bacteria inside the intestine can play a role in weight loss and weight maintenance. Circadian disruption. Yes, sleep is important. Interrupted sleep, lack of sleep, not sleeping through the full night, all can play a role in weight gain and poor weight loss. BMI. Most people have heard of BMI. It's a ratio of your weight to your height that we utilize to assess the risk to a patient from their weight. For instance, someone who's 5 feet tall and 250 pounds may have a much greater risk of medical comorbidities than a patient that's 6'6" and with a weight of 250 pounds. This is just to give you a sense of what's happened in the last 20 years. In 1995, there were very few states that had a high percentage of obese or morbidly obese residents. Compare that to 2016, where it's a much, much higher rate. And this has led us as a medical community to have to devise strategies to help people both lose and maintain their weight loss. Why is this important? It's not just about fitting into clothes or fitting into an airplane or a movie seat. It's really about your health. Obesity can lead to significant medical problems from head to toe. Migraines, depression, obstructive sleep apnea, worsening of your asthma, heart disease, high blood pressure, liver disease, metabolic syndrome, diabetes, acid reflux, urinary incontinence, infertility, polycystic ovarian syndrome, gout, degenerative joint disease. And for different people, one or several of these may be significant issues. So how do we treat obesity? So I'm a surgeon, but the first line of treatment for weight loss is not surgery. The first line of treatment for weight loss would be self-directed. Individuals making changes on their own in what they eat, what they drink, and their activity level. For some this may work, but for others they may need to go on to more professionally directed assistance, which may include more changes in their lifestyle, more changes in their diet, visiting a nutritionist or an obesity medicine specialist, and even utilizing anti-obesity medications. If these don't lead to the desired result, patients may then seek weight loss surgery. Weight loss surgery does require making all these changes to be most successful. We can also use obesity medicines to help patients in the post-op period who have either gained weight back or did not get to their goal weight. So what is bariatric surgery? These are procedures that are developed to help patients lose weight, and they may be restrictive, decreasing the size of the stomach, or malabsorptive, decreasing the ability of the intestines to absorb all the nutrients and all the calories. And many can combine both restriction and malabsorption. These procedures may cause hormonal changes which help in the weight loss, and most surgeries are now performed minimally invasively or laparoscopically. So who's a candidate for surgery? Surgery is indicated for a patient with a BMI over 40 or with a BMI over 35 with medical problems including diabetes, hypertension, or obstructive sleep apnea. So what are the surgical options? The laparoscopic adjustable gastric banding, the laparoscopic Roux-en-Y gastric bypass, or the laparoscopic sleeve gastrectomy. The lap band has actually lost favor, and our group is not performing the surgery at the present time. It is important, however, that patients who have a lap band are seen for follow-up to ensure that they're not having any asymptomatic complications, and patients who have not lost the weight that they desired with the lap band are candidates for other procedures. Laparoscopic gastric bypass. This is a video, an animated video, of the gastric bypass. It shows the laparoscopic trocars, so these are small. Usually this is done with 5 or 6 small incisions. The instruments are placed through the trocars into the abdominal cavity. We see everything on a high definition TV screen. So we see the stomach and the intestines. First, we create a small gastric pouch, size of a little smaller than an egg, separated from the remainder of the stomach, called the gastric remnant. Then the small intestine is divided, brought up, and connected to the pouch. So the food goes from the mouth to the pouch to the small intestine. But the enzymes that are required for digestion come through the second limb, and that's connected to the small bowel here. So you see the food as the blue stream and the enzymes for digestion as the yellow stream, and then they mix and digestion and absorption occurs in the distal small intestine. So this is a combination procedure combining restriction and malabsorption. It's been done for a long time. There's a long-term sustained weight loss. There's a high rate of resolution of comorbidities such as diabetes, hypertension, and obstructive sleep apnea. With the bypass of the intestine, there is the potential for nutritional deficiencies, so patients do need to take vitamins, and that's lifelong, and they do need to have periodic blood tests to ensure they're getting the vitamins they need. Some patients will develop dumping syndrome, which can be unpleasant. Complications can happen with any surgery, and we will go over this in more detail in person. Sleeve gastrectomy is the next procedure we'll discuss, and this is an animated video of the sleeve gastrectomy. Again, small laparoscopic incisions, replacement of the trocars or tubes that allow us to place the instruments into the abdominal cavity. The stomach is separated from the surrounding organs, and then the stomach is divided with a stapling device. And this portion of the stomach is actually surgically removed. You are left with a narrow tubular stomach that looks somewhat like a skinny banana. The food passes through this narrower stomach into your small intestine. And then the rest of the intestine is followed in a normal pattern. So this is a restricted procedure. It induces rapid and significant weight loss. It does change your gut hormones, which aid in the weight loss. It is somewhat simpler to perform than the gastric bypass, and for certain patients does allow for conversion to other procedures. As a portion of the stomach is removed, it is not reversible, and as with other surgeries, there can be complications. So surgery is really the tip of the iceberg. Surgery is a tool that will help people lose weight, but we need to make sure that our patients understand that dietary changes are necessary and increased activity is also necessary. And that's why we have a multidisciplinary approach to bariatric surgery. It's not just the surgeons, it's the entire team that makes this successful. So initially in the operating room, we have our anesthesiologists, our surgical staff, our instruments, our tables that are geared toward our bariatric population, and this makes the surgery safe and go smoothly. And in the office and in the post-op period, our nutritionists, our psychologists, our physician's assistants, as well as our nurse coordinator, all make sure that patients get in for their follow-up, get their follow-up phone calls to make sure they're doing well, and are available to answer any questions or concerns that may arise in the postoperative period. So thank you for your time. I hope you will look at some of our other videos that we have for you, and we hope to see you either in the office or as a virtual visit via telemedicine. Thank you for your attention.